Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be going over how to identify and correct sacroiliac problems. What is the sacroiliac? That is the joint between one of the large pelvic bones called the ilium on the right, the middle triangular shaped bone called the sacrum in the middle, and then another left ilium bone. So therefore, sacroiliac joint. It's the largest joint in our body. So that is the pelvis as a whole. We have a right sacroiliac joint and a left sacroiliac joint. And how you identify those problems is to find out if a person has sacroiliac subluxation or misalignments is, first of all, you palpate the spine and pelvis, which is what I'm going to do here. And right here we have some tenderness on the right side. Now usually this will also manifest with pain and tenderness as well as muscle hypertonicity or even spasm in the lower lumbar spine. So he's sore right here, L5, L4, L3, all the way up into his upper lumbar spine as a result of his sacrum and sacroiliac joint being misaligned on the right. Now we come down here and check his leg length, and sure enough, he has a right leg that's short by 1/2 inch. Now when I bring it up, it actually gets 1/2 inch longer. That tells me that he has a counter rotation in his pelvis. Now if you notice, watch when I bring his legs up, watch his pelvis raise up off the table and twist right there. And that tightens up right there, doesn't it, Brian?
Yes.
Yep. So, we've identified that he has a right sacroiliac subluxation. What I'm going to do is now take and adjust this sacroiliac on the right. And you notice that I'm doing several different moves in the X, Y, and Z axes. We are adjusting in the X axis, the Y axis, but also the Z axis. And now I'm on his right sacrum. Now I'm in the middle of the sacrum. Now I'm on the left side of the sacrum, and you notice I'm pushing those mostly superior to inferior, but he's still got some rotation here in his right sacroiliac joint. Now I'm going to adjust his left sacroiliac and acetabulum or hip joint. Now we're going to come down here and check, and his legs are exactly even, and when I bring it up this time, there's no elevation, and his legs stay even. That didn't hurt as bad, did it?
No.
Very good. Now normally, when you have a sacroiliac subluxation, you will also have hypertonicity or trigger points in your pelvic musculature. The gluteus maximus, gluteus medius, and piriformis. So what you do is you come in here and you apply a direct pressure onto those trigger points. These are very sore and painful for most patients, so we just have them take in deep breaths and try to apply pressure while they're breathing out. And then we get down into the piriformis even. Now, every time a patient has a sacroiliac subluxation, they will also have the tensor fasciolata, or what a lot of people call the IT band, very stiff and sore and hypertonic, and that's sore, isn't it? Very sore. Now what I'm doing is cross transverse friction on his IT band or tensor fasciolata muscle, which will relax all the way up into his pelvis, very sore while I'm doing it. And also I am going to trick the Golgi tendon apparatus in the center of his hamstrings so that it will relax more as well. Again, we come down and check. He's exactly even. I bet that feels a lot better.
Yes.
Very good. This is your Houston chiropractor. That was the sacroiliac subluxation identification and correction. We'll see you next time.